Let's get into the Chiro corner. What do you talk about? Hand pain. So a lot of different things in hand pain. There's so many different things to, I guess, go through and where it could be coming from. It's not strictly just hand pain or hand numbing, tingling. Where is it coming from? So let's try to attack this with the expectation of you want to know where it's coming from and where the origin of it is. So the most common that we always hear, anybody get hand pain or anything along those lines, we hear is carpal tunnel.
That's the first thing they jump to right away.
Talk about carpal tunnel.
Literally, if anyone ever has wrist pain or pain going to the fingers, the first thing they come in and say, I have carpal tunnel. They've never been diagnosed. Doctors probably never even touched them, assumed carpal tunnel off the bat.
Yeah. The minute they hear hand pain, they just say carpal tunnel.
Carpal tunnel. Carpal tunnel is the compression of the median nerve. A lot of times what we see is there is a transverse carpal ligament that follows the wrist, and basically it's compressing that median nerve. I believe it's called the flexor retinaculum. That compresses it. A lot of times people do surgery for that ligament, and literally they just chop the ligament. But there's alternatives to that. We could work on that ligament and the muscles around the wrist to make them loose, because compression is tightness of something's going on. So if you work on that, you loosen up everything, the median nerve won't be compressed anymore. But people always want snip, quick.
And that's, it's a matter, is it an actual carpal tunnel? Like, is it, so the flexor retinaculum is literally right in here, and that's where they come in and snip it there. And a lot of times, like, what's causing that to be so tight? I mean, if it's repetitive motion and there's actual damage in there, which is just unilateral in nature, could be unilateral meaning one side. If it's just one sided in nature, well, carpal tunnel should be on your DDX, differential diagnosis. But at the end of the day, it's not, when it's bilateral, carpal tunnel sort of goes off my head right away. That's like at the bottom of the differential instead of the top.
Still there,
it's still there, but it's more at the bottom instead of the top of my differentials. Now, when it's sitting in here, like, there could be your, scaphoid or lunate or Pisces sitting right in that area causing it. Not Pisces, I'm sorry, but lunate. It could be just tightness of that area that needs cross-friction massage at that point. There's multiple different things that could be done. Now, carpal tunnel usually is overuse on that side, could cause unilateral one-sided numbing, tingling in these three fingers and half of your ring finger.
They say carpal tunnel is one of the things that can wake you up in the middle of the night. Yeah. And like the other thing is, like, God forbid, like cancer and stuff like that.
Yeah.
Which that's crazy how it's up there.
Yeah, but see, that's the thing. Like, I hate that stat because, like, if I sleep goofy on a pillow and my neck's in a weird position, my hand's going to go numb. Like, if you sleep on your arm, your hand's going to go numb.
Yeah.
So it's like, that'll wake you up as well. So just because then people will read that and be like, oh, my hand went numb and I got carpal tunnel. Done.
Or they'll be like, shit, like, I have cancer,
Yeah. So there's so many different things that, I hate that one thing encompasses everything. No, I'm sorry. That's not, it's too general. So with carpal tunnel, that median nerve just being entrapped with these three and then this lateral aspect of this ring finger, that's your major telltale of that numbing and tingling being there. It doesn't have to be all of those, right? It can just be these two.
It could be some of them, yeah.
It could be some of them, but typically if it's a true median nerve carpal tunnel entrapment, it's all of them.
That's why self-diagnosing is so difficult. Like,
so bad.
Because, like, numbness of pinky, numbness of ring finger, numbness of middle. There's other things that can do that too, such as TOS,
Yeah.
That's going to attack those as well.
Tunnel Guillain, cubital tunnel syndrome.
So it's like a bunch of things. That's why Google always puts you in a whirlpool, and it's like all over the place where it's like, oh, I have this. Oh, maybe I have this. Maybe I have that.
Yeah. So that's carpal tunnel, median nerve, right in here. Usually these three fingers with the lateral aspect of your ring finger. That's your numbing and tingling. Next one is that we got into last week with the elbow.
Pronator's teres syndrome.
Pronator's teres syndrome. And the telltale with this, carpal tunnel will not cross the wrist. Pronator teres goes from basically the elbow down. And that's usually what? You were just doing it?
Basically moving right to left.
A lot of your
clockwise, counterclockwise movements.
Yeah.
And this is a muscle that stretches over the ulna, goes into the radius as well, and then up into the humerus.
Yeah, so it's basically here and comes right down across. And just like the piriformis in the lower area, with this pronator teres, the median nerve runs through that muscle. So if you're repetitive stress, nonstop, I see it with a lot of females that actually hold their purse. right there.
You could see that as well,
And I see that a lot where they hold the purse there and it's choking off that pronator teres, which then in turn turns off the chokes off the median nerve.
Or people cleaning the kusa.
Cleaning the kusa, baby. That's it. So, that cross friction massage on that pronator teres, the picture's up there for you guys to see exactly where it is. Cross friction massage is great for that, to release that. And the telltale for that is if it's beyond or proximal, closer to the midline from the wrist, and it doesn't go from wrist distally to the fingers. If it goes from wrist to elbow and you feel that numbing and tingling in there, pronator teres got to be on top of your DDX at that point, at your differential at that point.
100%.
Next one, tunnel guion. Tunnel guion is your hook hamate and your pisiform right in this area here, and your ulna.
Yep.
It's telltale for this. Truthfully, you don't get numbing and tingling in these 3 fingers. You get them in these 2 fingers, in your ring and pinky. If anything's ring and pinky, that's it. Carpal tunnel's off the table completely. It is not that. It could be cervical radiculopathy. It could be tunnel guion. It could be cubital tunnel. Yeah. That's your ulnar nerve entrapment. You just got to figure out where, right? I
got a fun fact. So your funny bone isn't an actual bone. It's your ulnar nerve.
It's your ulnar nerve. So what happens?
That's any time that basically nerve gets touched or basically hit. Like I hurt mine a couple months ago where I was playing basketball and I had somebody in front of me and I accidentally hit the person in the face. I like to think his face hit my elbow. Yeah. And literally, man, I felt like heat was like in my hand. I thought my hand was bleeding.
Yeah.
And like I was on the floor, man. I couldn't feel it anymore. And now every time I play basketball, I have to cover it up.
Yeah.
Because if I take another blow like that,
yeah, and that's where it is.
I couldn't work.
Basically, here your funny bone. It's one of the only places that a nerve is fully exposed. Like you could actually physically palpate that area right in here in that groove,
and it goes numb when you palpate it.
Yeah, that nerve sits right in there, and it could go numb at that point. So that is your cubital tunnel. That's where repetitive strikes in that area, repetitive extension of the arm. So if you're pushing or anything like that on a regular basis, it could cause this issue.
That goes back to our elbow issues, elbows, or golfers, or tennis elbow.
For sure. That's it. So, but the thing is with that is it'll radiate down the arm
into
and
the
have
fingers?
that referred pain into the fingers.
I'm telling you, I feel like my arm was on fire.
Yeah. Whereas like that, like we mentioned last week, the golfers and tennis elbow stays in the elbow.
Yeah.
It doesn't affect the neurological side where it runs down.
It's more muscle on ligamentous.
Yeah. Whereas this is more nerve. Cervical radiculopathy is the big one. That's a big one that I think gets misdiagnosed or doesn't even get looked at. They want to jump to carpal tunnel. Anybody, whether you're looking it up on freaking WebMD or Google or whatever, it just gets overlooked completely because it's hard for a lot of people to connect. Wait, a problem here is causing all this down here.
The issue
I don't have pain here though.
For sure. The issue is people chase pain.
Yeah, well, that's it. That's my point.
That's the big issue.
Yeah, so you're chasing the symptom so much where you're not looking at where the origin of this symptom is. Yeah. So I think that's why it gets overlooked so much, and it drives me crazy because patients will look at me cross-eyed, like, but I came in for my hand. Why are you doing my neck? I'm like, I'm finding loss of curvature. I'm finding disc issues, 100%. Degeneration, anything.
I like to always mention cars. Like if something's going on with your radio, and sometimes it's not your radio.
It's not your radio.
What do you look for? You go to the fuse box, you look at the battery, you see what's going on. Yeah. Where it could be an outsource where it's not directly the actual thing, but it's something
it's
deeper.
Just referred pain. And listen, and we could adjust their hands so we're blue in the face and do treatment on their hands so we're blue in the face. But if that's a secondary issue to their primary problem, it'll keep on coming back.
Temporary relief.
Now, it's not saying that nobody ever has carpal tunnel, no one ever has cubital tunnel or anything. No, we see those. Yeah. But it's just a matter of we got to figure out which one it is verbatim and fix it that way. Mm-hmm. So with all these issues, it's stuff that we could help with. It's just a matter of how and what treatments we need to render. So a lot of cervical, obviously radiculopathy, we're doing our chiro stuff. We're doing any type of, decompression if need be, if it's a disc issue. But everything else, man, the treatments that we have, I mean, you got your cupping, you got your cold laser therapy, you got your electrical stimulation, you got your cross friction massage with the scraper, you have ultrasound, multiple different things that we could work on it. And you know what? I think next Chiro Corner we talk about each one of those individually and what they do, because we've been throwing them around a lot, but maybe there's not a great understanding of what cold laser does,
what care is,
what cupping is, why are we doing it. So maybe we pin that in for next time.